The scope of EDH is so complete and complex that we really had a chance to appreciate really what we would need to do to help people get ready to implement that in an already extremely busy workplace. Our leadership was very proactive in both giving the local support staff protected time to learn EDH and in facilitating our presence on the unit with our peers. It was a very one-on-one process that a lot of the clinicians felt was really instrumental to their learning EDH. The super users were chosen because we had a high level of comfort in using CIS at that time and using the electronic medical record, and had also demonstrated both an interest in and a willingness to assist our peers in implementing EDH. I was, as everyone was, tremendously concerned about the process and grateful for the opportunity to get the early introduction to the program. And I know it was a great benefit to my unit that I was able to start using it early, and then I was able to help anticipate the level of needs and time and effort that it would take for us all to adopt EDH successfully. I feel that people have responded to it in a manner that I think speaks very highly of our dedication as clinicians to wanting to do the right thing to our patients. A lot of people were very concerned at the beginning, not resistant per se, but concerned, as anyone would be concerned about a major transformation of the way they do their job. I think the local support staff really facilitated that and reduced the anxiety levels on the nursing units tremendously. When they developed the implementation plan, they actually pulled us local support staff out of our clinical assignments for several weeks and enabled us to continue to have that one-on-one time. I think there was at least one local support staff assigned to every shift for up to 6 weeks after go live in most nursing units. There was a strong feel out there on the floor that everyone wanted to do a good job with this and wanted to learn how to do the best thing for the patient and for each other. We also had a great voice in the Nursing Oversight Committee, which continued to meet every Wednesday morning throughout the year. Very early into the implementation of EDH, it was apparent that one of the most challenging workflows was to get the lab draws. Both the orders, the timing, the workflow was something that was suddenly being generated and driven by a completely different process, and we didn't have a lot of insight as to what that process was. And we really sat down together and worked out how to communicate with each other better and how to optimize not just the way the labs were operationalized on the floor, but even to learn how the labs needed to be ordered according to the program to happen in the way that our provider colleagues needed that care to happen. We've identified throughout all the units that we need to maintain that communication between the units and the actual users. I find it very rewarding personally to be that resource for my colleagues. There are times that it feels like the electronic medical record is driving patient care, but I think we all recognize that this is a process. The benefits of it, I feel strongly, kind of outweigh the burdens and the concerns, and I think the information that we'll be able to get back out of the system is really going to help us give the best care to our patients.